Oh boy, I am Marwan Cameron, and this is the Conduit. All right, y'all, it is November 2nd. It is election day. Oh boy, I hope you have voted. If you have not, get out there today. Power is taken, it's not given. Exercise your power, vote. Well, you know what time it is. Normally, our show is on Monday, but today we shifted it to Tuesday for our weekly podcast with Kitsap Public Health. And today we have Holly Bosted back, so let's go ahead and get her on in. Good afternoon, Holly. How are you doing?
Hello. I know I'm like, good morning, good afternoon.
I actually had to peek over at the clock. So I was gonna say good morning. I'm like, I don't think it's morning. Quickly shoot a glance over there. It's like, all right, it's noontime.
Just barely.
How you doing?
I'm pretty good. How are you?
Well, you know what? I'm blessed and highly favored. And I was telling folks I did 3 podcasts yesterday, so I wasn't having a good day, but today I'm feeling pretty good, Bow
Nice.
tie Tuesday, so I'm feeling it. I got my purple on, so I'm coated, I'm suited and booted, and ready to get to work. How about you?
Yeah, same. It's a beautiful Tuesday, so I can't complain.
That sounds a little bit flat. I need you to turn it up a little bit, I need to get a little bit more excited.
I mean, we got a lot going on. Yeah, it's busy as usual. So
Absolutely. Well, and I know you're fully busy, and we're squeezing in this little bit of time in your super busy day. But over the weekend, there was the emergency approval for the vaccine for pediatrics, right? Children from 5 to 11. So we wanted to
yep.
talk a little bit about that today, and then maybe peruse the website and kind of show folks how to navigate that so they can get answers to their own questions outside of the times they can come to the conduit or other places that they get information. So let's jump into that.
Yeah, so the Pfizer vaccine, which is one of the two mRNA vaccines, was approved for children 5 to 11 years old, which is exciting and something that we've been anticipating for a little while now. So that's exciting, and the health district will be giving out, administering Pfizer vaccine for 5 to 11-year-olds at our flagship clinic that we have at the old St. Michael's Medical Center, the old Harrison Hospital in Bremerton on Cherry Avenue. And we're still, figuring out the logistics and the kinks. But one thing I just want to say right off the bat is that for parents who have children who tend to have trouble with vaccines in general, I think our location is not going to be the place for them to go because we're not doing. I think the plan is to take a picture of the vaccine room. And for anyone who's been to that clinic before, we're going to be doing the vaccines in that same room. And so it's
Okay.
not, individual rooms. And so if you have health district staff are not going to hold down people's kids. And so if you know that that's your kid, you should be going to your primary care doctor or a primary care doctor because we just don't have staff capacity to do that.
Right,
So,
absolutely. So you're saying right now the old Harrison Hospital will be the flagship site for parents to bring their 5 to 11-year-olds to get vaccinated, but ultimately they should probably go to is it a pediatrician?
yeah. So, I mean, right now, parents can contact their primary care providers. They're the pediatricians that, if they have established care, are working with a physician already. That would be the number one place for them to go. And also, just if the kid has met the doctor before, they're more likely to be more comfortable. And so, we're hoping that the health district can fill some of the gaps for folks, but it's by no means the place that we're directing everyone. First stop should be your doctor that you already go to. The other thing I will say is that so right now we're administering Moderna and Pfizer and J&J. So Wednesdays is a Moderna clinic, and Thursdays is our Pfizer and J&J clinic right now.
Let me type that in the chat. So you're saying Wednesdays is the which one?
Wednesdays is Moderna, and so we're doing first doses, second doses, and then also boosters and third doses for immunocompromised folks.
And what time is that on Wednesdays?
Let me just double check because it has changed.
And this is also the old Harrison Hospital?
Mm-hmm. Yeah, so this week it is 2 to 3:30.
Okay, 2 to 3:30.
Mm-hmm. And then for the J&J and Pfizer on Thursday, hold on. Let me just confirm on Stephanie's email. Okay, no, actually it's 2 to 4:30. Sorry, the Moderna one.
2 to 4:30. Okay.
2 to 4:30, and I can pop the registration link in the chat so people know.
Oh, I like it. I like it.
Where to go to register. Okay, so this is where folks go to register for any. Wait, how do I type in the chat?
You'll see private chat probably to the bottom left there, possibly.
Oh, here we go. Okay.
Ooh, and we already have questions today. So as soon as you do that, I'll ask you the first question that's come in.
Okay.
From our audience.
Cool. I'm ready.
All right. So Lucia Jones, shout out to Lucia. She's asking, do you have contact tracing in Kitsap? Excellent
we
question.
do. Yeah. We have a team of contact tracers and case investigators. So if folks have cases to report, they should call the health district, and I can put our general number in the chat as well.
For those that might not know what contact tracing is, would you just explain that?
Yeah, so when someone tests positive for COVID, when you report the case, then someone from the health district calls you and gets a list of your close contacts. So people, they'll ask you a bunch of questions about when you think you were exposed, when you first started experiencing symptoms, and then who you've been in contact with. And we'll kind of nail down in the window of when you're contagious. Then they'll reach out to the folks that have been exposed, and it's completely confidential. Like they don't tell folks that it was, the name of the person that they were exposed to or where or anything like that. But just to notify folks in hopes that they can go get tested so that we can do a better job of keeping on top of when we have positive cases, and so that folks can quarantine appropriately to mitigate and stop the spread of the virus.
Absolutely. Thank you for that. Because there's so many there's so much terminology and information out there. It's like, oh, what is this? What is that? So there is contact tracing in Kitsap. And you kind of explain that there. So that's fantastic. And then to report positive cases, we're going to go ahead and put that in the chat, but you can call 360-728-2235. And Holly, why is it a good idea to report those positive cases?
It's really important so that folks know if they have been exposed and should go get tested. Because I think, not everyone experiences symptoms, or not everyone experiences the same symptoms. And so it's one of the tools in our toolbox of ways for containing the spread, that it's really important that folks do call and report it when they do have positive cases, so that we can stay on top of it and have folks stay at home if they have COVID.
Now, Lucia is also saying that she works for Clark County Tracing Health, and they call all positive cases.
Mm-hmm. Yeah, that's the goal. That's the intention. But it's hard to do that when folks aren't reporting, or, even not getting tested too. So, yeah, our testing, kind of like a lot of other places in the state, slowed down when cases slowed down and then went back up. And now we're trying to we have community-based testing sites that we partner with the county to put on. And then there's a lot of other places you can go. I know a lot of pharmacies do testing, and like the Super Savers, and Walgreens, CVS's, Walmart. So yeah, I agree. We need to continue to prioritize testing, because that's how we know.
So I have a question for you. Right now we're coming into, and this is kind of off topic a little bit. I want to make sure we cover everything for the pediatrics, but we're coming into flu season, and from what I'm seeing in the news, they're saying that we might actually have a flu season. We had a kind of a stifled flu season because of all the social distancing last year, and so we can maybe get a double hit of corona plus the flu, and maybe even more colds, right? So what should people do? How do you know the difference between, hey, my kid's got a runny nose and or I'm feeling a little sick, but it's not COVID? Like, how are we going to chart those waters? That seems like really, I don't want to send my kid to school, thinking, well, it's just a runny nose, but then it's like it's actually COVID.
Yeah. So I would say, when in doubt, get tested, and get your kids tested, because that is one way to know, or, an important step in figuring out if you have it, and to go to school or go to work or go out in public or not. I'd also say that some of the same measures that help protect us from catching the COVID virus will also help mitigate risk for catching flu. So, wearing a mask, being more vigilant about wearing a mask and keeping it on, and if you are somewhere where someone's sneezing and coughing, to keep it on, even if folks are vaccinated. It's just, masks work, and I'm sick of wearing one. I know some folks don't mind it, but I'm gonna continue to do it because I don't want to get the flu or COVID.
I'm not gonna lie, I was so happy when I could finally take my mask off at Planet Fitness. It was crazy on the treadmill. You're on the treadmill, you're pouring down sweat. You can wring the mask out. It's like, oh, I get to free my mask, because I was vaccinated,
Yes.
and then it's back again. It's like, oh man, But
Yeah.
ultimately, I had to break through COVID, and I tell you what, I'm gonna put my mask on. So
Yeah.
it
I
ain't a
will
problem.
say, it surprises me a little bit, the Planet Fitness in Bremerton. Folks are not the best at keeping their masks on all the time, and
Facts.
stresses me out a little bit, but also I don't want to be going around telling people to put their masks on. So I'm just keeping mine on. Yeah.
So, was there anything else that you wanted to mention about pediatrics? I know we got a shorter time, and I do want to make sure we kind of peruse the website a little bit. But folks can, go to the old Harrison Hospital, which is now called St. Michael's. Is that what it is? It's going to be Harrison for me for a long time.
Yeah, we refer to it as both because different people, it rings a bell differently. I would say, I just want to make a quick announcement or plug for, the health district is starting to conduct some key informant interviews to help better understand the trends or themes in Kitsap that contribute to vaccine hesitancy, and just kind of like what questions people have and what ways they get information. And so if anyone is interested in doing one of those interviews, myself and then Karen Boysen-Knapp are the two main folks who will be interviewing people. And we're not trying to convince people to get vaccinated, and we're not going to shame anyone, and there aren't any right or wrong answers. We really are just trying to understand people's perspectives and kind of the roots of their hesitancies. And we are compensating folks for their time. So people will get $40 or $50 gift cards per hour based on if they're in person or virtual. So
Ooh, I like that.
yeah. Well, I mean, we gotta show people that we want to honor their time, and that's one way of doing it. So feel free to
And that
share.
has started now.
Yes, yeah.
Okay.
Yeah. So feel free to share my info, or you could collect names of folks and give their info to me, and I can reach out to them, whatever people want, whatever is easiest. And we are trying to get some geographic diversity. So we don't want to interview all folks from one part of the county. So in particular, areas of focus are Bremerton and South Kitsap. And also, people don't have to be unvaccinated. They can be vaccinated, but if they have thoughts and opinions and want to chat about what they know about hesitancy and just what they think about COVID and how it's impacted them, then they still are eligible.
Well, that's awesome. So while I'm going to ask you to type your information in the chat so I can share that out.
Yeah.
And as Holly said, you can also contact us and we will make sure that you get onto Holly's list. And of course, we're at Gather Together, Grow Together. Our phone number is 360-373-3000. Our email is gather2grow@g2g2.org. So I'm putting Holly's information here in the chat because I know some of you are only listening and not watching, so you can't see it. So it's good to say it also. I don't always do that, so I'm getting better at that. But Holly Bolstad is Bolstad at kitsappublichealth.org. So you can or call her cell at 360-233-6247.
Or you can text me too. That works.
Or you can text her too. Whoa, you're giving out your cell phone. Go ahead. Brave soul.
Bring it on. I'm ready.
So Sal says, good word all. And got my booster this weekend. So
Yay!
That is awesome. Shout out for that. You know what? That's a good question. You know, I've had COVID and I'm 6 weeks out at least now. So it should be okay for me to go and get my booster, right?
Yes. Yeah.
Here's a big question. Can I get my COVID booster and a flu shot at the same time? Because I usually do get the flu shot, or should I wait?
I think you can get them at the same time, but not at our clinic. We're not doing flu vaccines at that clinic.
Okay, so, but it's okay to get both?
Yeah, yes, yeah.
Okay. So I was worried about that, and I was like, all right, so let me ask you this. Even if it's okay for me to get both, if I'm like, you know, I'll just get one this time and then I'll get the other one, which one would you recommend getting first? Or does it really make a difference?
No, I don't think it makes a difference. If you are someone who has responded strongly to either in the past, flu or COVID shots, I would, it's up to you. It's your decision and it's your body. But I think personally, I would probably split them up. I got my flu shot last week, and sometimes I have some symptoms after getting flu shots, but this year I didn't at all. So.
Well, Sal was saying COVID is more deadly. So if you are going to choose one before the other one, maybe you do the COVID first. That is very logical. I do like that. I'm thinking right now of being sore in both shoulders. Like you got a flu shot and a COVID shot. And I'm like, I can't lift anything. Oh my God.
Yeah, maybe not.
So, Sal, I think I might take your advice. Go ahead and get the Moderna, because I got the Moderna. So I'll get the booster shot. I know one of our board members just got his booster, and then I'll go ahead and get my flu shot maybe that next week and make sure that I'm good. Because, I mean, it's been into the low 30s already, mid 30s. I mean, this was in October, the beginning of November. That's kind of a scary thought that it's getting that cold that fast, and it's wet. And, yeah, I just want to try to be as healthy as possible.
Mm-hmm. We love that.
So what I was going to ask you is, we did get the information for Wednesdays from 2 to 4:30 for the Moderna at Harrison Hospital, but did we confirm for the Pfizer?
So Pfizer and J&J this week, same spot. The first appointments are at 3:30 and the last appointments are at 6. The first couple slots, 3:30 and 4, are almost filled up. So yeah, you're going to be getting times that are on the later half of that.
Oh boy, I can't spell Pfizer. Was it P? PF?
Yeah, Pfizer. It's it's not phonetic, so.
I'm like, oh, I've seen it so many times. Like, oh, I cannot spell it.
And I think just to reiterate again, so that everyone knows, Pfizer is the only vaccine that can be given to children, and it's also the only vaccine that can be given to 12 to 17-year-olds. So it's the only one that's been approved for the 5 to 11 and the only one that can be given to 12 to 17-year-olds, because we've had some confusion about that at the clinics.
Gotcha, for sure. Okay, so we've covered kind of pediatrics now, and again, we'll be coming on and having a conversation on Mondays. So we'll give you the most up-to-date information. You'll be able to answer or ask questions and receive information. So don't feel like, oh man, I need to get it in. And you can always respond in the chat to this podcast, no matter when you end up watching it. I will get that information. I will pass it on to Kitsap Public Health and get those answers for you because that is really important. And that's really the whole point. But I wanted to spend the last little bit of time that we had kind of just perusing the Kitsap Public Health website so people can understand how to navigate if they want to kind of look around and say, okay, what are the numbers looking like? Are the numbers going down? Are they going up? What's it look like in my county? So could you just take us on a really quick tour? Just show us a few things. Just tell me where to click.
Yeah. So can you click on that banner?
Right here?
No, down where it says COVID updates and resources. Does that go anywhere? We're changing stuff around. Okay. So scroll down then. Mm-hmm. So this is our general vaccine page and information. And that's another thing to remind folks. So we used to be taking walk up for boosters. But now, because of our increased capacity and because we're trying to put together these kids clinics, we're no longer doing that for the moment. That will likely change in a few weeks or a month once things die down again. Okay. But yeah, this is where you can find a calendar of what our upcoming clinics are, which vaccines will be administered, and the times. So keep going down.
Awesome. That's really nice and easy, and then I love it.
Yeah, it just says it right there. So if you click on that outreach toolkit, click. So this has some videos of community leaders, and then there should be, if you keep scrolling down.
Hey, I know these people.
Yeah. So then we have some flyers that detail vaccine information. These are a little dated. Keep going down. Looks like Sal got to walk up anyway. So the one I want to highlight for folks is this one. Oops, go up right there. On the right that says talking about COVID-19 vaccines. So that one has some really helpful tips and information for when you're talking to family members about vaccination. And I think it's important to keep in mind for folks that telling someone that you think they're stupid for not getting vaccinated is probably not going to change their mind. And folks that at this point are not vaccinated usually have a reason and, have some thought behind it. And it's not just for no reason. And so trying to listen to understand folks, I think is really helpful. So that's just one that I want to highlight. And then also asking permission if they're willing to share and talk about their why Asking permission before sharing your thoughts, I think, is really important too, like getting consent before just talking at folks because maybe they're not interested in hearing. So I think that one is important and worth highlighting.
Well, what's awesome too is below it says find reliable information about the vaccines. And we know that when you're looking for reputable information on the internet, you're looking for things that end in .gov or .org versus .com. We are working with, so you'll see the cdc.gov hashtag coronavirus and COVID vaccine, Washington or WA.org, and then of course the Kitsap County owa.us/vaccine. And so we're working with the Kitsap Regional Library. So hopefully they will be coming on here in a couple of weeks and showing us how to actually do some research and kind of cut through the noise when we're trying to get information. So I think that is really tremendously important. It's so hard, right? We're on Facebook, we're on Twitter, we're on Instagram, and we're flooded with all this information. And some of it seems really good. Some of it comes from folks that we care about and we love, and typically we would trust them. And so it's like, well, I mean, it came from Nana, so why would I not believe Nana? You know, she loves me. But we need to do that investigation for ourselves. And so we're definitely looking forward to having the regional library come on and kind of navigate the internets, if you will, and to figure out how to safely find information that isn't biased and steeped in science and logic and all that good stuff.
Yeah, I'm really glad that the libraries are doing that. That'll be really helpful. And I think it's a good reminder for all of us to be to think a little bit critically about where we're getting our information and who it's coming from and maybe what their angle or agenda is, and comparing multiple sources so you're not getting all your information from one. And if you're hearing the same thing from multiple different sources, then you know that increases the chances that it's true and of its validity. So I think that is really cool.
Well, I got to give a shout out to you for that. Because that was born out of the collaborative meetings that you put on every other week, that's centered around equity and health. So definitely thank you for that. So that's how the work is getting done behind the scenes, and this is the fruit of that work that happens behind the scenes. So more than just conversation happens, or just this is just a meeting for the meeting. You have the committee for the committee. Nothing ever gets done. No, things actually do get done. People do collaborate. People find different ways to work together and share information. So thank you for that, Holly. We really appreciate that.
Yeah, of course. And that's also a good reminder to folks, to anyone who watches your podcast. Anyone is welcome to join. It's, a public group. It's for everyone who is interested in vaccine rollout and access and other, public health issues in Kitsap, and kind of connecting with other community members to think and brainstorm about what we could do to address any of those public health issues. So feel free to ask Marwan for the information for those meetings, or reach out to me and I can share that with you as well.
And so we've got 1 minute left. Could you quickly just navigate us to where we can find like the latest data, the stats here in the county on what's going on with COVID? And I'm typing the website in the chat for everyone. kitsappublichealth.org/community health/COVID-19/coronavirus_vaccine.php. Those of you on video, you can see that. If you are watching this later, you'll be able to access it, but it is right there for you. But I hate to just give folks websites. It's great to kind of look around so you know what to look at when you finally get a chance to look at it after work, or whenever you get a chance to take a look at it. It might be a few days. And you're like, oh, where do I go again? So this would be very helpful.
Yeah, so for the highest level kind of snapshot of our data, if you scroll all the way down to the bottom of this page that you're on right now,
oh,
this is where our data lives. So that the first two kind of temperature gauges that you see, that's up a little bit. Yeah,
got you right here.
that's showing what percent of our population has initiated vaccination, which means has their first shot, and what percent of the population 12 plus is fully vaccinated.
Wow. So we're almost at that 70% threshold, huh?
Yeah, and I'm guessing at some point they will change it to, or maybe they'll do a separate breakout for 5 plus, since that group has just been added to populations that can get vaccinated. And then you see the breakdown kind of in a different format, and it shows which information is coming from our state information system and what is coming from the Department of Defense and the Navy. And then that spread with the orange bars that you're looking at right now, that shows the timeline of when doses have been given, when COVID vaccine doses have been administered. And if you continue to scroll down, that is our demographic information. So it'll show age groups and dates of the age groups, and then geographic region. And then we've got race and ethnicity broken out in a couple different formats. And then by
counties here, which is awesome.
Yes. Yeah. Yeah.
Come on, Bremerton. We got some work to do. We're lagging behind here. I live in Bremerton.
It's true.
All right. So, yeah, this is great information. And it's literally, once you hit the website, just scroll down to the bottom. And this is updated, I would assume, like weekly. Is that true?
Yep. Yeah. It's updated weekly, I believe, on Tuesdays. Yeah.
Gotcha. Well, today's Tuesday.
Well, it looks like it was last updated last week. So maybe by the end of today, it'll be updated.
It'll be updated. All right.
Yeah.
Well, we are 2 minutes over. I know you've got to get to another meeting. And like I said, we're coming to you every week. We want to thank Holly, Kitsap Public Health, for coming on. Of course, I don't think Holly's going to be able to join us. She was going to join us at 1, as we have Dr. Yaw coming on from the Fred Hutchinson Cancer Center to talk about prostate cancer and Black men's health specifically. So get yourself a beverage, use the restroom, grab something to eat, and come on back, because we'll be back here in less than 30 minutes. Holly, any last words before we go?
No, just thank you so much, and thanks for all that you do, Marwan.
Well, I appreciate you, and I will continue to do the best that I can for as long as I can. Always good to have us, our pictures on at the end and not a graph. Yes. So I appreciate you. Have a fantastic week, and we will see you next week.
Sounds good. Thanks, Marwan.
All right. Goodbye, everyone. See you in